Hey, Professor, hope you're doing well. It's Maram Al-Dahabi, by the way. So, today I'll be walking you through the key insights that I found from the healthcare data set, and I will be showing you some visuals I created where I compared between different variables, medical conditions, insurance companies, some demographics, hospital performances, test results, and so on. So I want to start with this decomposition tree that I've created for the gender. Our data is somehow evenly split. Roughly, we're talking about 27,774 males and 27,726 females out of the total number of 55,500 in all patients. Then I created this pie chart in which I wanted to show you which age interval is mostly admitted to hospitals. So here it shows that the highest age interval is between 61 and 89 years old, and this is around 36.7%. The second highest is 46 to 60 years old, and this makes around 22.34%. Then I created this area chart in which I wanted to look at the medical conditions and this compared to the count of hospital and sum of billing. I found out that although the medical condition arthritis has the highest count of people being admitted to hospitals, however, the sum of billing of diabetes is more. This has an explanation. Maybe the medications for diabetes is more expensive. Also, we see from this tree map that Cigna has the highest billing amount between all other insurance companies, followed by Blue Cross at 283.2 million and Medicare 285.7 million. Here I created a filter in which we can filter between females and males. So if we try to put the females here, we see that females are mostly have the highest medical conditions in diabetes and also it has the highest billing amount, whereas it has the highest medical conditions, and the highest billing amount here for males are for asthma, and for males it is Medicare which has the highest sum of billing. If we wanted to filter females, we see that uh, arthritis is the highest count of hospital in medical conditions. Moving on to the results and discharges, I've created this line chart in which it compares between the sum of length of stay and the count of discharges. So we see here that abnormal results have the highest length of stay and somehow a very high discharge date, whereas the normal results, patients who have normal results, have also a high length of stay and has the lowest discharge rate. So here we can see that there is something wrong in our data, missing data maybe, because it is not normal that people who have normal test results and they don't have any medical conditions to have the lowest discharge rate and the highest length of stay. Then I wanted to show you here the count of date of admission by year, and we can drill it down or up to quarters, months, and maybe days. Here, this narrative is to summarize the data here, and it shows you those data by numbers. So, for example, the abnormal accounted for 33.56% of sum of length of stay. Here, I have put a filter on this page where it shows you the discharge date. So we can maybe select people in May 9, 10, 11, 12, 13, 14, like this, and we can play around here in the data. And here we can also check those normal data. In May, the inconclusive had the highest length of stay, and the abnormal results had the highest discharge date, which is not normal usually. Then, moving on to the medical and hospital visuals, I've created those two tables where it shows medical conditions versus the sum of billing and hospitals versus the sum of billing. We've seen that diabetes have the highest sum of billing, although the arthritis have the highest count of people admitted to hospitals. Here we see that LLC Smith Hospital has the highest people in it, admitting in it, and it covers and it ha and it and a lot of insurance companies are signed within this LLC Smith. Here, there's two slicers where we can also check if you want to check something specific, like let's say anything. Let's say this hospital. It shows you the total billing of it. It shows you the medical conditions that's in it and the billing of those two. Let's say if we wanna filter out slicers for cancer, we see that the sum of cancer in all hospitals is 232 million, and those are the hospitals that serve the cancer with a total billing of 232 million also. Filters are also on this page on visuals are on filters are also on those pages, so we can check them by gender. We can do gender. So out of those cancer medical conditions, the females results in 116 million billing. And those are the hospitals that admit female cancer are the top here. Then I want to talk about the strategic and tactical recommendations. So first of all, let's remove those filters. So first of all, I would want to prioritize the high billing conditions like the diabetes and the obesity ones. People with diabetes and obesity have a relatively the highest billing conditions. Then we may build a program in which it takes more care and effort to elderly people within those age interval. Like maybe we can do more checkups, screenings to ensure they are in a better health. We can also include an education program for the younger bracket, this bracket, and how to prevent themselves from diseases. Third recommendation is maybe we can address this drop down in the billing in 2024, maybe by checking the CRMs if there is a human error, and so on. Last thing, I want to talk about the implementation consideration. I really want to talk about this because it is very important to consider how we can improve this data set and how we can improve those graphs here. So maybe first break down the medical condition data by department or insurance provider, look for inefficiencies. Second, train the staff on discharge terms and conditions and have them integrate the patient's test results in the system. In that way, we will be able to flag abnormal and inconclusive discharge risks. So now doctors won't be able to discharge them. They have to follow a certain protocol. Lastly, for the implementation consideration, always enhance and update the dashboard or the CRM, whatever technology the hospital follows, with real-time data to identify high risks patients, to avoid discharging at like discharging without not on a correct date. So that's a wrap up. Our data clearly tells us where we should focus. Chronic conditions, we should focus on elderly age group people. Maybe the insurance companies should have some kind of contracts with hospitals to decrease the billings. And by aligning those operations with the insights, we can reduce the cost leakage, and we can increase the quality of care at hospitals and hopefully drive better health outcomes. So that's it for my presentation of my Power BI. Thank you so much, Professor, for this course. It was really amazing and challenging. Thank you.